All right, welcome to the Daily Briefing. It's Tuesday, June 23rd, as we continue through Cordova's response to the pandemic. And there are some developments with case counts at Ocean Beauty, a couple of more, and rather than have a bunch of pretense, we'll just get right into it with Mayor Koplin and Dr. Sanders on today's episode of the program. Dr. Sanders, we'll begin with you. Some kind of unwelcome news to begin today's briefing. Can you tell us what it is that's been discovered?
Yeah, so I certainly think unwelcome but not startling. We identified 2 additional positive cases of coronavirus during the asymptomatic screening. Both of these individuals are employees from out of state that work at Ocean Beauty. They were still in their quarantine period, and I feel that at this point this is another case of contained screening, identifying the positives. I feel reassured that the risk to the community is still low. Ocean Beauty has a closed campus. They have a very, very small number of individuals that leave the campus to go into the community for groceries and banking needs. We're making sure that we get those individuals tested as well as any close contacts of the positive cases tested.
Okay. We talk about these bubbles and which are these little spheres of contact. Do we know and I understand everything we do on the air, we recognize HIPAA and the privacy needs and those kinds of things. Do we know if these new cases are related to the other one, or are they a completely separate bubble, so to speak?
I think it's a little too early to be able to definitively say one way or the other. We are sending the test to the state, and the state does do some genetic analysis to help us determine the origin of this virus versus the previous cases that we identified. So the state will be doing that for us. In terms of the processor plan, Ocean Beauty has an excellent plan, and they do have working bubbles. So they've got, even within their campus where they have many individuals working, they have those divided up into subgroups and bubble groups, if you will. So I still think we have good plans to slow any spread. Even if there is some spread within a certain facility, it will be a small number thanks to these kind of operating bubbles they've created. Okay.
Does anything really change? Does it? You sort of addressed this before, but does this? We now have 3 active cases where we're sort of used to there just being 1. Does it raise a new level of concern, do you think, for the community?
I don't think for the community. I think for the facility, it definitely has them paying a lot of attention and maybe adding a little bit more testing than we would have normally added. Otherwise, I don't think it raises concerns for Ocean Beauty, other processors, and certainly at this point, I don't feel like there's added concern for the community. I, just like previous, still want everybody being cautious, really paying attention to their own health care and if they're feeling ill, letting their provider know, calling ahead, continuing to eat healthy, exercise, and do those things that keep our body in the best shape possible. So when coronavirus does get to our community, we're ready to handle it. At this point, I do not feel that it is in the community.
So does anything really change in terms of how much testing is done, or is it kind of like last time where really it's unfortunate that we have cases, but really the story overall is a testament to the effectiveness of plans, and the community really shouldn't worry?
I think that this is still that same story. We're catching things early, paying a lot of attention. And this is in the very early developing of these cases. So if we have information and that changes, we'll certainly get that out. But I still feel very reassured in our process.
Okay. Mayor, you've been... I'm sorry.
I was going to say the community might see that the numbers of tests that we're doing has been going up significantly. Part of that is doing this airport testing for new arrivals. We have a lot of people coming in, and there's a lot of movement throughout the community. So our testing is definitely increasing in terms of what we're conducting, but that is not because of these cases.
Okay. And so nothing really about that is going to change, it doesn't sound like.
No.
All right, Mayor, you've been listening. Anything to add to what's been said?
No, I would just say that in the discussions with the state, and yesterday I called in and participated in the industry call after we got together, and they reiterated that, they've passed the responsibility for keeping communities safe and keeping businesses and their employees and their customers safe onto the businesses. And I think we're fortunate in our case that our processors had already stepped up and not only put plans in place, but real actionable processes to make sure that they executed those plans. And I think what's impressed me is that our processors and our medical team and Dr. Sanders continues to adapt. So even though we say, well, nothing's really changed in our overall risk level, I think what has changed in some of my conversations with Dr. Sanders and just observations through the incident management team is that Dr. Sanders and the medical team are constantly assessing and saying, what can we be doing differently? How can we be doing this better? And I see the processors doing the same thing. They're adding layers of process and protocols and in cases dropping others that aren't really contributing. So I think that's the real thing that is fortunate for us is, again, the collaborative environment here where the community members and our medical team, our processors, our fishing fleet are working together to try to make sure we have good outcomes. And yes, it's concerning to have more cases, but again, it underscores that the screening testing is working and it's putting us in a position where we're being proactive instead of reactive.
Okay. Well, and in moving on now to something somewhat related that involves people coming into and out of the state, and it's been an area of concern for folks, obviously, online, is the ferry announcement that came out regarding their plans for checking. And, some people are saying, well, does this basically just cripple our ability to use the ferry, even though it's hardly coming in anyway? So, Doctor, maybe to you again, when you saw those the plans that had been put forward for the marine highway vessels, what was your reaction to those?
Well, my initial reaction was, great, we're ready to test Cordova. We will increase our testing to help our residents and people here that need to be getting on the ferry have their results in time to make that happen, and we're always ready to adjust. The other thing is, it looks like the state is thinking about the plans and how they keep communities safe. One of the medical response team's responsibilities prior to getting the press release from the state was figuring out how we ensure Cordova is safe as the ferry is arriving. It's good to see that the state's thinking about these processes and is going to ensure that passengers are screened prior to boarding. That will protect the ferry workers, protect the ferry system, and also will protect Cordova as those arrivals are coming. Those people have already been pre-screened in some capacity. But I do think that those guidelines are probably going to be changing from the state.
Okay, yeah, because, Mayor, as you and I talked about yesterday, Cordova is not really the concern in what the state has laid out. People trying to get on the ferry to go somewhere from Cordova are in great shape because of how effective our testing is. It's the thought of going somewhere, whether you go to Whittier or Valdez, and then not being able to get home as a result of the testing not being as good in other communities. So do we know anything new about that problem? Is anybody having that conversation?
Actually, we are. And Representative Foods, I kind of picture her as having two red phones. And those were the phones back in the Cold War era. The president could pick one up and it would ring on the Russian prime minister's end, and they would talk to each other and exchange threats and whatever. So I think Representative Foods has two bat phones. and one rings up the Commissioner of Transportation, and the other rings up the Commissioner of Fish and Game. So she got a hold, reached out to DOT and Alaska Marine Highway System after I called yesterday, and she had some conversations, and it looks like the administration wasn't real clear, or they're in the process of clarifying what their intentions were with those protocols. And for the testing protocols and some of the more restrictive pieces, it looks like they're really targeting the interstate travelers that are coming into Alaska, or the long Gulf of Alaska runs that are stopping at multiple communities where there's multiple transit workforces and high-risk communities, and then cross-Gulf sailings. So for little interior routes like between Prince William Sound communities, it looks like we're going to be exempt from some of those requirements for the same reasons Dr. Sanders suggested, that our risk is low and we can test and screen effectively on our end. So I think from what I saw from Representative States when we exchanged text this morning, that DOT is going to have some announcements out, hopefully later today or tomorrow, sometime that will clarify. And for those that are making travel plans, we'll have a little more clarity on less restrictions, hopefully.
Okay, so nothing. We should point out then that while it's looking good, possibly for Cordova to not be impacted by some of these more challenging rules, that it's talk at this point, and it's another one of these things where we really ought to see it show up on paper. But there maybe is reason to hope that this is not going to be as challenging as it first appeared. Exactly,
and the reason I'm being pretty forthcoming and at least the conversation level is we have a lot of people have been calling me saying, "Hey, we're scheduled to leave here in just a few days, and we'd like to know what the requirements are," because it's hard enough trying to work the schedule without having to try and figure out where I can get a test in Anchorage or Valdez or Whittier to be able to get back on the boat. So hopefully we have some good news coming here in the next day or two.
Okay, well, we'll see how it evolves. Maybe we'll move to sort of closing comments at this point. Clay, since I've been talking to you, anything else you want to add to either of these subjects?
No, I just, again, want to encourage the community to keep following protocols of distancing and sanitation and mask wearing. It's in the off event that something slips through the screening, that second important layer of protection, that veil between the community and summer workforce is our behavior, so we need to keep it up.
Yeah, I mean, we do have, to a great extent, that the vast majority of the of one keeping oneself or one's family from getting exposed is what we do of our own accord. Doctor, what about you? Final thoughts?
I just want to add in, I know I'm always talking about the testing availability that we have here in Cordova, but it really is pretty substantial and amazing to get results as quick as we do. I want to remind everybody that although we do often get our results out extremely quickly, we're not guaranteeing these test results are out and will be available sooner than 24 hours. So if you haven't heard in 24 hours, that would be the time to start calling and asking for your results. Also, for any kind of travel, and if the ferry testing does stay in place, we want people to plan ahead, recognizing that we do need 24 hours to get results to the individuals. A lot of communities are taking 5 days to get these done. We're lucky we have them relatively fast here, but please give us that 24 hours. And then still just thanks to all of the community support and people that we have that are helping with this massive testing effort we have going forward. It's really helping us identify and recognize our risk here in Cordova. Thank you.
All right. Well, thanks to both of you for the chat. We appreciate it, and we'll continue to keep in touch, obviously, and see how things evolve. Mayor Koplin, Dr. Sanders, really appreciate it.
Thank you.
Thanks.
All righty. That will complete our briefing here for June 23rd. Again, a number increasing. We never want to have increase, but feels like we can take confidence from our mayor and our doctor at the head of the incident management team that Things are falling within expectations. And then continuing work on these ferry rules that were proposed recently by the AMHS and trying to make sure they actually work properly for Cordovans who need to be able to use that service, particularly in its limited capacity. Want to remind you again about the assets available for keeping up on Cordova's response. There's the website, covid19.cityofcordova.net, the 424-INFO number, INFO, that you can call not only to get information, but possibly leave some with somebody that you'll actually be visiting with on the phone. And then that information line provided by the Village of Eot, 424-WELL, that has pre-recorded information. These programs are heard in the 1 p.m., 5 p.m., and 8 p.m. hours on the radio, and of course our archive for listening on demand as soon as Robbie can get them up there once we do our first one. YouTube.com/Cordova TV. Feel free to share links to that channel so folks outside the community that want to keep up on what's going on can do so. And we will get your regular programming back underway now on the Clam and the Eagle. Glad you could join us.